So hi everyone, I'm Charlotte. I work at Mind in Bradford. I'm one of the service managers there, and I am the programme lead for Youth in Mind. Just to echo again, really grateful to be here today. Thank you for inviting me. Hopefully I can give you a bit of a whistle-stop tour of Youth in Mind, and then just really keen to listen to the feedback and just take some time to consider that and how I can learn from it. So Youth in Mind is an integrated.
Can I just say something? Somebody's got their mic on and I can hear lots of feedback. I'm just thinking for the recording.
Oh, thank you. Right. So Youth in Mind is community-based mental health service for children and young people in Bradford, Airedale, Wharfdale and Craven. And we're a partnership between health, local authority and voluntary and community sector. Our support is a range of different services that generally fits into that getting help quadrant of Thrive, so early intervention. We use a non-medical model, but it is evidence-based support, and we kind of slot in between that stage between self-care and then getting more specialist support. We have a number of different services available, so we've got 9 different services from 7 different providers. So it really is just a whistle-stop overview today. A few of the services are school-based and schools kind of make the bookings, but the ones I'll explain a bit more are where an individual can be referred. So we have Buddies and Craven Buddies and Know Your Mind that all offer one-to-one support for young people. The Buddy offers can also connect young people into peer support groups. And we also have WRAP, which is Wellness Recovery Action Planning, and that is a group support model that helps young people to identify wellness tools and create action plans for their emotional well-being. Our aim at Youth in Mind is to really recognise and respond to the individual needs of each young person. We work in a person-centred and inclusive way. That means basically that we focus on needs rather than diagnosis, and we use a goal-based approach to support where we help a young person to determine their own goal and how they would like support to work towards that. The support is voluntary, so we do ask that young people want to engage, but having just read one of the comments in the chat, just to point out that we do recognise that it can take some young people time to want to talk and explain things. So we use quite that creative approach to help build trust, and I'll come on to that a bit later. I do just want to be really honest and not kind of overpromise what our offer is, and just let you know that some of the services do have short waiting lists. We do aim to offer an initial session in 3 weeks, but some of the one-to-one support doesn't kind of kick into the full support for about 6 weeks. And then WRAP does have a slightly longer waiting list because the group runs for 12 weeks, so you kind of have to wait for the cycle to run through. In terms of referral, there's a lot of information on our website, or you're welcome to contact us and the different providers as well. All the services will accept referrals by kind of professionals like school, can sometimes refer in as well, GPs, and then some of the services do accept self-referrals as well, such as Know Your Mind. Generally, we support young people aged 11 to 19 or up to 25 with additional needs, but a few of our services do start from age 8 as well. There's a couple of location-based criteria. For example, Craven Buddies support in Craven, whereas Buddies support in Bradford, Airedale and Wharfdale. All that information is on our website. Like I said, I'm sorry, it is such a whistle-stop tour of everything. Please can have the next slide. So I thought it'd be useful just to share some of the themes from referrals to illustrate the types of support that we do offer across the different services. So just on the left there is a list of those different themes, starting from kind of the most common. So at the top there, we've got anxiety and stress, we've got kind of increasing confidence to attend school, and then helping to access different activities, so like the peer support groups. We've then got support for family relationships, low mood, and friendships as well. And on the right hand side, I've just put a few of the outcomes that young people have achieved. So the top two, we've got increased ability to recognise, articulate and manage their emotions, and then increased confidence and self-esteem. And both of these are kind of themes that come out top in terms of the themes of the goals that young people work on. We've got lots of other themes there, so things like helping to return to school, reduce feelings of anxiety and low mood, enhanced relationships and increasing support networks, and that includes supporting people to access different community groups. And we also help young people to access more specialist support as well. And then just to finish, I thought I'd just briefly talk through a very quick case example to illustrate what that all actually means for a young person. So one young person was referred to us for one-to-one support while they were awaiting an ASD assessment. They'd been experiencing difficulties with their family relationships, were struggling to attend school and struggling with a fear as well. The young person set a goal that they wanted to improve the relationships with their siblings. And over the course of the sessions, the young person was supported to explore their feelings and emotions. And they were supported to do this through a variety of different games and role play, as well as some creative activities that they enjoyed doing. And the practitioner took that time to engage the young person with those different activities to build that trust initially. Through that approach, the young person was able to explore and kind of recognise the causes of the fear and communicate that back with their parents. So some changes were made that helped to change that for the young person. And then they also improved the relationships with their siblings. That was their goal. And they went from their own assessment of that goal being a 1 at the beginning to going right up to a 10. And then finally, they also started to increase the time that they were attending school for, where the practitioner really helped to share the young person's needs with the school so that that could be achieved. That's it from me. Thank you very much for your time, everyone.